Frequently, we encounter questions to our practice about the FUT procedure versus the FUE procedure. So the FUT procedure involves an incision in the back of the head. That's usually a small hairline incision in the back. We close it very, very carefully. As a plastic surgeon, I'm obviously suturing and closures are very important to me, but there is a linear scar in the back of the head. The FUE procedure is where we take out the follicles by hand individually. So there's no linear scar at all in the back of the head, but there's thousands of potentially tiny little dots. Those dots tend to heal up really beautifully. We use a 0.6 millimeter punch, which is the smallest punch available on the market today. So it's essentially invisible to the extent that a hairdresser, barber, and so on can't even see that anything was actually done. It's really remarkable stuff. So the question is, which is right for me? The short answer is that for FUE procedures, we typically have to cut the hair really tight in the back of the head for the donor area. So most men who wear their hair reasonably short will elect for the FUE procedure because they don't want to have to deal with the linear scar. And also women who wear their hair short will also probably want to do the FUE. Patients that elect to do the FUT procedure with the actual incision, the advantage of that procedure is you don't have to shave your hair in the back at all. And so therefore, women who have long hair, men who have long hair, who don't want to cut it down for the procedure, usually are better candidates for the FUT procedure. So FUT is really reserved for people with longer hair, typically. The FUE procedure is usually reserved for people with shorter hair. I can tell you that for someone who has shorter hair, who wears their hair relatively short, the FUE procedure is now the absolute predominant procedure. So we probably do, on people with short hair, at least 90% of our procedures are FUE and 10% are the FUT. Women with longer hair and men with longer hair, I'd say it's probably the other way around. It's probably 90% with the FUT and probably about 10% with the FUE procedure. So I hope that helps.